Thank you very much, Kirk. Well, LASIK surgery has now become a rather common medical practice, and we're fortunate enough to have with us this morning Dr. Tyrie Jenkins to talk about the latest developments in the procedure. Good morning, Dr. Jenkins.
Hi, Brenda. How are you?
Great. And you were named the Lasik Star Surgeon in 98, 99. Congratulations to you.
Thank you.
There were a lot of scare stories in the media of late, ever since this thing became popular. It was pretty hip to get laser surgery.
Right.
Is there any reason why there should be people who are scared of this surgery?
Well, I actually kind of welcome in some way that kind of coverage, because I think it makes people really realize that this is a surgical procedure. It does have risks and benefits, and it's very important to research those.
Okay.
I think this is a fabulous procedure. I've actually done everybody in my family, so nobody's wearing glasses anymore. So I personally believe in it, but it's not for everyone. And so I think those articles kind of stimulate that and make people think twice before they jump into this procedure.
Are there different types of laser surgery to be had then?
There are different types of lasers. There are surgeons with varying experiences, and it's not a commodity. It's a surgical procedure, and an informed public is very important.
Can you explain what it is and what a person can expect if they do come in to see you?
Well, what happens in laser surgery, it's a procedure where we have a laser that actually reshapes the eye. What happens is initially we make a flap, and here's a photo, a schematic showing making the flap. The next step is actually to reshape the eye using the laser technology, and we can treat nearsightedness, farsightedness, and astigmatism. And finally, what happens after that is we place the flap back into position, and it's this flap that makes LASIK surgery quite spectacular, because many patients, the next day are able to drive without their glasses. So that's why LASIK procedure has become a very popular procedure, because it's a real wow procedure, because you walk in one day and the next day you don't have glasses. But there are risks and benefits. For example, not everybody's a candidate. If your cornea is too thin, or your pupils are big, or your prescription is out of the range that we can treat, then you shouldn't have the procedure done. And it's important that when you go in and speak to someone who's going to be doing your procedure, that they do a lot of testing to make sure that this is a procedure that's going to work for you.
So you always advise your clients to come in for a few consultations before they even say yes?
Right, right. In fact, I always sit in the screenings where we just sit and chat and talk about the procedure to see if they're a candidate. I spend more time then just talking about what their lifestyle is, what they do, what their hobbies are, trying to decide whether this is a procedure that will benefit and enhance their lives.
Do people ever come to see you for cosmetic reasons? They just don't like the way they look in glasses?
That's a big motivation. Some people who can't wear contacts anymore for some reason or another, just don't like the fact, the way they look with their glasses. And actually, to be honest with you, with glasses you don't see quite as well, because you don't have good peripheral vision, and that's one of the motivating factors, is to try to get rid of those.
But that's okay, though, right? Just to go in.
That's fine, as long as they're a good candidate, and that is kind of a driving force in our society today.
What are the disadvantages of going through a surgery like this?
Well, there are certain patients that say have dry eyes, that this procedure can exacerbate dry eyes. Patients that have larger pupil size will sometimes have difficulty with night vision. And so those types of patients may actually, even though they see well, perceive that their vision is slightly decreased after surgery because of the dry eyes and because of the night vision problems.
Okay. Now, this surgery, this costs in the $1,000 range.
The prices vary a little bit. It costs anywhere between $1,000 to $2,000 per eye. It kind of depends on where you go, the surgeon, experience level, and
covered by medical health insurance.
It's not, and I think price really is a factor, but shouldn't be the deciding factor when you decide to have surgery. I think you need to make sure that your surgeon is experienced and that you have confidence in your surgeon.
Great. Well, thank you so much for joining us today.
Dr.
Tyrie Jenkins.
Take care.